Good morning, the chairman, medical elders, and senior colleagues and colleagues. My name is Michael Oguntoye, as I've been earlier introduced, and I want to especially appreciate the leadership of NME, especially the CME committee, for giving me this opportunity to set some perspectives concerning COVID-19 vaccine. And for the next couple of minutes, I'll be talking about the COVID-19 vaccine, demystifying the myths and fallacies. My outline is shown on the screen, and I'm sure we have listened to several presentations, read several documents that is related to this topic. So we all know COVID-19 is a viral disease caused by the emerging strain of coronavirus that is known as severe acute respiratory syndrome coronavirus 2, actually noted as SARS-CoV-2, and it belongs to the family of coronavirus. And this strain of virus causes common cold and more severe respiratory disease. And COVID-19 is a short way of writing the name of the disease, just as it's shown as the CO stands for corona, the VI for virus, and the disease, and it was discovered in 2019, so it's called COVID-19. So we are all aware of the symptoms of the disease. Commonly, there are fever, different types, dry cough, tiredness, difficulty in breathing, and some individuals may also experience other symptoms like pains, nasal congestion, sore throat, and diarrhea. And we all know that the pandemic has caused massive disruptions around the world in terms of the economy, social life. We have had several shutdowns and reopening of different sectors of our life. And before now, vaccine has actually played a significant role in disease prevention, and vaccination has been considered as one of the most successful public health stories of our time. Before vaccines were introduced, infectious diseases were major causes of morbidity and mortality around the world. The discovery of smallpox several years ago signaled the beginning of a new dispensation in public health. And however, after then, there have been alleged vaccine safety issues which tend to derail immunization programs in several instances and different countries. About 10 to 12 years ago, even before the COVID-19 and some other recent diseases were discovered, the WHO designated the year 2012 to 2022 as the decade of vaccine. A lot of works and efforts went into this. A secretariat was set up at the WHO headquarters in Geneva, as designated as the decade of vaccine secretariat. And there are so many different working groups. And the idea is that because of the importance of vaccination in disease control, it was envisaged that within that space of time, within that 10 years interval, several new vaccines will have been rolled out around the world. If not because of the pandemic, around this time, we'll have rolled out several other vaccines that have been under trials across the world, including some of them that have acclaimed good safety profile. But the COVID-19 vaccine, the COVID-19 itself actually disrupted this plan. So along the line, the COVID-19 vaccine was discovered, and studies are still going on the safety profile of some of these candidate vaccine. However, I think there are enough evidence to say that the vaccine are good to be used in the human population. COVID-19 vaccine will not be the first vaccine that will be developed within a very short period of time. Like I remember in 2010, there was a pandemic of swine flu, that's H1N1, and within about 6 months, a couple of vaccines were developed for the disease, and it was administered to frontliners, just like the COVID-19 vaccine around the world, until the COVID-19 pandemic started late 2020, and everybody started talking about vaccine. However, we know that vaccine, like other drugs, are not devoid of adverse events, which occasionally follow vaccination, although they may not actually be a causal relationship. However, everybody has the fear of some unknown adverse events that may follow vaccination. The main objective of the COVID-19 vaccine introduction is actually to slow down and interrupt transmission of COVID-19 outbreak in all parts of the world. There are multiple COVID-19 vaccines that are available globally, and countries are encouraged to take appropriate decisions based on the recommendation of the World Health Organization. And in this part of the world and some other poor countries, the COVAX CMC is a financing instrument with which this COVAX vaccine is made available. So we have the COVAX CMC facility, which is actually anchored by Gavi, and it is through this facility that the vaccine is made available to poor countries. So about 180 countries and economy are involved in the COVAX facility, because the world actually recognized that our best hope of ending the acute phase of the pandemic is only through the COVAX, because that is the only platform that will give the poor countries access to this vaccine. And it's only through this means that the vaccine will be made available to us, not only because of the cost, but also for us to have an even distribution of the vaccines. I will not be waiting for the big boys to finish vaccinating themselves before the rest of us access the vaccine. So it aims to improve access of available supply and programmatic support for procurement and campaigns to Gavi eligible countries. The federal government of Nigeria, like many other countries, has formally communicated its interest to Gavi to participate in this COVAX advanced marketing commitment, and the country is presently a beneficiary. So basically, for now, there are about 4 main types of COVID-19 vaccines that have been approved or are currently in various stages of vaccine development. So the first group is that the whole virus vaccine, which uses a weakened or deactivated COVID-19 pathogen to trigger protective immunity. An example of those category of vaccine are the Sinovac and the Sinopharm. The second category is the RNA or the messenger RNA vaccine, which consists of the mRNA molecule. This is a synthetic code for parts of the SARS-CoV-2 virus, specifically the virus spike protein. And this is the one that the Pfizer and the Moderna vaccines are marketing in some parts of the world. The third category is the non-replicating viral vector. This type of vaccine introduces a safe modified version of the virus known as the vector to deliver genetic code for the antigen. In a COVID-19 vaccine, the vector is the spike protein and is found on the surface of the coronavirus. So this is the type we're actually presently using in the country and many parts of the world, including the UK, and even that was recently approved by the United States for use. And that's the Oxford AstraZeneca vaccine and the Sputnik 5. The fourth category is the protein surveillance vaccine, which include harmless species of protein of the virus that cause COVID-19 instead of the entire germ. Once vaccinated, the immune system recognizes that the protein don't belong to in the body and begins to make its T lymphocyte and antibody in response to the antigen. So I'll quickly go through some of the characteristics of these 4 categories, and I'm going to start with the one that we are using locally here. That's the AstraZeneca COVID-19 vaccine. The vaccine comes as ready-to-use liquid formulation and does not require dilution. It comes as a 10-dose vial, although when we started using the vaccine, it required that some of them contain as much as 13 doses, 12 doses, 11 doses, and is given at 0.5 dose intramuscularly. Once it is open, the vaccine should be discarded within 6 hours, or if it is exhausted, whichever one comes first. It has different shelf life at different temperatures. If at 9 months, it will stay at plus 2 to 8 degrees centigrade for 9 months, and at plus 25 degrees for 30 days. Although that's at room temperature. Although studies are still going on this, and it's recommended to be given as a 2-dose schedule with a minimum of 28 days interval between the first and the second dose. It does not have a preservative, and for now, it doesn't have a vaccine vial monitor on it. It is stored in the refrigerator with temperature monitoring device with the temperature of plus 2 to plus 8 degrees centigrade. Luckily, this is the temperature where we have been storing it, that we have been used to storing most of the vaccines that we are currently using for API. So it does not necessarily pose any cold chain challenge to the country. And I guess that's one of the, apart from its availability, that's one of the reasons why the country settled for the AstraZeneca vaccine, because the logistics is easier for the country to handle. So contrary to what a lot of people think, that because it is cheaper, because it is less potent, but there are other logistic issues that were put into consideration before they finally agreed on the AstraZeneca Oxford vaccine. The second one I'm going to be talking about is the mRNA Pfizer-BioNTech COVID-19 vaccine. And this is the one that initially the country was trying to settle for, but when the logistics were taken into consideration, and even the doses that was going to be made available to the country, another decision has to be taken, because it actually requires ultra cold chain storage at minus 80 to minus 60 degrees centigrade at the national level. And at the subnational level, this is going to pose a lot of problems, because most eventually we may not be able to keep the vaccine for more than a week, and we all know what that means. So the vaccine is a frozen liquid and required to be diluted after thawing using 1.8 ml of diluent. So we also have the challenge of carrying diluents around with the vaccine itself. It's a 5-dose vial, and also does not contain preservative, and it's also discarded after 6 hours of dilution. It also requires 2 doses to guarantee full protection with a minimum of 21-day interval between 2 doses. The shelf life is different at various temperature. For 6 months, it will be kept at minus 90 to minus 60 degrees centigrade. For if at the present stage which we are storing the AstraZeneca vaccine, the mRNA Pfizer-BioNTech cannot be stored for more than 5 days at that temperature, and it should also be discarded after 6 hours of dilution. The third category is the Johnson & Johnson COVID-19 vaccine, and it's also a formulation that is readily available for use. The temperature is also it's also logistic friendly, at least for this part of the world. It's also a 10-dose vial and does not require reconstitution. It's also given at 0.5 ml per dose and also muscularly. And the advantage this one has over the other two is that only 1 dose is required at first contact, and it does not contain preservative, and it should also be discarded 6 hours after withdrawing the first dose. So also the first batch will not come with the VVF. So all the vaccines, because they call them the pandemic supply, they are not actually coming with the vaccine vial monitor. So the other COVID-19 vaccines are currently still in various stages of development. So some of them are in various phases of clinical trial, like the Sinopharm, the Novavax, and the Johnson & Johnson, the Sputnik 5. So I want us to know that all these vaccines that have been developed, only the ones that have been approved by WHO under the WHO emergency use listing is considered for use in Nigeria. So whichever vaccine you see that is being used, because I learned that very soon the Johnson & Johnson vaccine may also arrive in the country, but at a very limited dose. So because of the availability, the National Technical Working Group has to prioritize who and who to get the vaccine, and this has been divided into different phases. Fortunately, unfortunately, for the phase 1, which is meant for the health workers and other frontliners, because of vaccine hesitancy amongst this category of people, some other people took advantage to access this vaccine. So the phase 1 is actually meant for health workers, frontliners, people at the point of entry, the laboratory network, the security men, and phase 2 for older adults that 50 years and above, and those with comorbidities who are 18 to 49 years of age. The phase 3 is going to be targeted at people in states and local government with high disease burden and who were not captured in the earlier 2 phases. And the phase 4 will be to other eligible populations that the vaccine is made available. So basically, most of this vaccine emphasize that individuals who are less than 18 years of age cannot take the vaccine. Although the Pfizer group is saying that people will be as young as 16 years, but generally we look at people from 18 years and above before the vaccine is given. In Nigeria, the strategy that we are using to deliver the vaccine are 3: that's the fixed post, the temporary post, and what we call the special team. The fixed posts are domiciled in the health facility, whether primary, secondary, or tertiary. The temporary posts are designated areas where people can gain access to the vaccine, but they may not necessarily be health facilities. Then we have the special teams that who move around to targeted places to deliver the intervention and the subsequently withdraw to base. So before we move forward, I would quickly like to talk about a concept that has always been considered very critical component of any immunization program, whether it's COVID-19, whether it is routine immunization, and that is the adverse event following immunization. Just like for drugs that we try to track adverse events, AEFI for vaccine is a very important component of the immunization program. And the essence of it is actually to strengthen the immunization program by identifying events that may happen after an individual must have been vaccinated. Whether the event is related or not, the immunization program tends to capture them and to do proper analysis to ensure the safety profile of the vaccine in question. So by definition, an adverse event following immunization is any untoward medical occurrence which follow immunization and which does not necessarily have a causal relationship with the usage of the vaccine. So AEFI is broadly classified into 2. So we have what we call the regulatory classification, which can be serious AEFI or non-serious AEFI. Then we have the cause-specific classification, and this one has 5 categories. So this could be what we call the vaccine product-related reaction, vaccine quality defect-related reaction, immunization error-related reaction, which was formerly called program errors, anxiety-related reaction, and the coincidental events. So the adverse events may be any unfavorable, unintended sign. It could be an abnormal laboratory finding, or it could even be a symptom that is observed after an individual has had an exposure to a vaccine. So for the non-serious AEFI, it's defined as an event that is not serious and does not pose a potential risk to the health of the recipient. This occurs within 2 hours of injection and resolves after a short period and poses little danger. So this includes things like fever, it includes pain, includes swelling at the site of the vaccination. So serious is not it's not synonymous with severe. That is, it does not mean the intensity or the severity of the event. So serious AEFI is defined as an event causing a potential risk to the health or the life of a recipient, leading to either a hospitalization or prolongation of existing hospitalization for individual already hospitalized and got a particular vaccine. So for instance, if an individual is vaccinated and he or she develops encephalopathy, seizures, or aseptic meningitis. Number two, it could be persistent or significant disability or incapacity. For instance, a child takes the polio vaccine and that child develops paralysis. That is a serious AEFI. Or any event that happened after an individual has been vaccinated that is life-threatening, if results into congenital malformation or death. If any of these events happens after an individual has taken the vaccine, even if you cannot establish a causality, it's actually defined as an adverse event following immunization. That's why we don't actually use the word reaction. That this is an event that happened after immunization. So, like it has been mentioned earlier on, vaccine-related reactions are AEFI that cause or present by vaccine due to one or more of the components or properties of the vaccine product. The quality defects AEFI is present by a vaccine that is due to one or more quality of the vaccine product, including its administration device as provided by the manufacturer. Let me just throw a light on this. For instance, somebody takes a polio, and a child takes a polio vaccine that is not properly inactivated, and that kind of person that child develop paralysis. That is a vaccine quality defect related reaction. The third one is immunization error, or what we call program error, and that's an AEFI that is caused by inappropriate handling, prescribing, administration of the vaccine. Probably the vaccinator is using an aseptic procedure, or the vaccine was not properly stored, on the program managers was not vigilant in administering the vaccine. Things that has to do with the program. These are what is called the immunization error related program. The other one is the immunization anxiety related reaction. This one does not necessarily have to do with vaccine. We saw an example even with the COVID-19 vaccine of an individual that took the vaccine and complained of dizziness and was about to have a syncopal attack. So that one has been documented with a lot of vaccine over time. And then we have what we call the coincidental events. That is probably an event that is coincident with the time the vaccine was administered on the individual. So we have a reporting structure for AEFIs normally, even before the COVID-19 vaccine came in. And more importantly, there is an app that has been discovered now, that has been put into use now, that individual, if you're with the COVID-19 vaccine, you can always report whatever it is. Anything that happens after you have taken the vaccine should actually be reported, because this will provide evidence to actually review the safety profile of the vaccine. So there's a reporting structure. What we normally encourage that an individual who gets vaccine and notices anything after being vaccinated should report to the health worker at the vaccination post, so that proper documentation can be made. And the program actually emphasized that an individual that reports an AEFI should be treated free of charge until a causality is established, and we're able to clearly say that whatever is happening is not due to the vaccine. So the Med Safety app is currently in use by the NAFDAC to monitor adverse events for COVID-19 vaccine. They have been using for adverse drug reaction before now, but it's we emphasize now that that app should be used also by any literate person to report the COVID-19 adverse event following immunization. And this will go to a server which will be analyzed subsequently and be able to actually review from time to time, review the safety profile of the vaccine in the country, and even can be sent to a global platform so that to strengthen the immunization program. So back to COVID-19 vaccine, the COVID-19 vaccines are generally believed to be safe and effective. Currently, over 40 million COVID-19 vaccines have been administered in 50 mostly high-income countries, and recently countries in this part of the world too have commenced vaccination. The vaccines have been evaluated in tens of thousands of participants in clinical trials, although trials are still ongoing. An intense vaccine safety monitoring system has also been established to ensure that COVID-19 vaccines are safe, and some of which I've earlier mentioned in the course of this presentation. NAFDAC is the lead regulatory agency in Nigeria that is providing technical guidelines and rigorous scientific standards to guarantee vaccine safety. And all the COVID-19 vaccines administered in Nigeria have been approved as safe for use in Nigeria by NAFDAC. So what are some of the common myths and misconceptions that's about COVID-19 vaccine? A lot of people believe that the COVID-19 vaccine, there are some COVID-19 vaccines actually made for African countries. Initially, when the AstraZeneca came, it was said, no, why must they bring AstraZeneca to Nigeria? That it is less potent, the efficacy is low, but the vaccine is also used in other parts of the world. UK has been using it, and millions of doses of AZ vaccine has been administered in the UK, and recently the United States also approved it. France, Germany, and most parts of other European countries are using the AstraZeneca vaccine we are using in Nigeria. The other debate is about alteration of human genetic information, but both the company and other scientists have refuted that allegation that the vaccine does not have anything to do with DNA, but only triggers immune response. The immune response that will be protected to the body. So the other thing that say that people say once you take the COVID-19 vaccine, that they are indirectly inserting a microchip into your body so that it can be tracked with this Chinese G15 or whatever they call it. So the COVID-19 vaccine do not contain any microchip or any other harmful substance for that matter. All vaccines, including COVID-19 vaccine, are manufactured under strict compliance with the WHO guideline. And COVID-19 vaccine, some people say it can cause clinical infection. They are actually attenuated vaccine, and the vaccines are only capable of eliciting immune reaction and not produce clinical disease. So all the trials that have been conducted and is being conducted have not been able to demonstrate anyone who had the vaccine administered to, or let me say it has not been documented that anyone had the vaccine administered on him or her and developed the clinical COVID-19 disease. There's also this debate about do I need to take COVID-19 vaccine to have recovered from an active infection. So we don't have enough evidence to say that if an individual is infected, that it confers lifelong protection. In fact, there are several data on individuals who have been reinfected. So it is advisable for people who have had infection earlier on to also take the vaccine. Another issue of concern to so many people are that the vaccine was rapidly developed, so that the effectiveness and safety cannot be trusted. Like I mentioned at the beginning of the presentation, this is not the first time vaccines is developed within a very short interval like that. I mentioned the instance of the swine flu about a decade ago. And moreover, technology has also helped the process of vaccine development. Unlike in those days where research and development would take decades, technology has made a lot of things easy now. And so vaccines were developed because of scientific advances that have made over the years. Moreover, the SARS-CoV-2 is similar to other coronaviruses that has been seen in humans. So previous research that have been done on the other coronavirus actually sped up the process of the COVID-19 vaccine production. The example is example I would like to cite is that of the Sanofi, the company, the laboratory where they produce the flu vaccine in France. For the past 1 year has not been producing the flu vaccine again. They have been seriously engaged in producing the COVID-19 vaccine. So leveraging on the experience that they have gained from the production of the other flu vaccine in the past. Some other people can get COVID-19 from the vaccine. I mentioned that earlier on. So people say if you have an underlying condition and suppressed immune system, you should not get vaccinated. The fact is that individuals have underlying condition at higher risk of getting COVID-19 and its complication. So it's more advisable that they should get vaccinated. And when I was showing the slide on the phases of the COVID-19 vaccine introduction in Nigeria, I mentioned that people with comorbidity are actually people that are even, after the health workers and frontliners, they are supposed to be in the second phase of the vaccine introduction as more vaccine is made available. The other issue is that the COVID-19 vaccine affects women's fertility. This was even said about polio some years ago. It has been said about some other vaccine in the past. So there's absolutely no data from clinical trials or any theoretical reason as to why the vaccine could cause infertility. A lot of people say you should not give to pregnant women. That's a group that's, but some scientists have the opinion that they rather should be the group that should be urgently vaccinated, like the healthcare workers. So I want to summarize by saying that there is no such thing as a perfect vaccine which protects everyone who receives it, and it is entirely safe for everyone. Effective vaccines induce protective immunity and may produce some undesirable effects, which are mostly mild and clear up quickly. The majority of events such related to the application of a vaccine are actually not related to the vaccine itself. Many are simply coincidental events. Others are due to human or program errors and not necessarily due to the active ingredient of the vaccine. It may not be possible to predict every individual who might have a mild or serious reaction to a vaccine, though there are a few contraindications to some vaccine, especially if somebody has had issue of anaphylaxis or allergy to a particular vaccine or any of its components. That vaccine may be in contraindication to that individual. So when we follow this contraindication, the risk of serious adverse effects can be minimized. So on this note, I want to say the COVID-19 vaccine so far have been demonstrated to be safe. Studies are still, however, going on the safety profile of the vaccine, as in to what extent can some of the AEFIs that have been reported adhere to the vaccine itself. Thank you.